Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. We'll be brief today, but I did want to come on and just say a few things. We are doing better in many ways, and in other ways, we're kind of stifling and going back and forth. We believe that the vaccines are helping. We also believe that the health measures, the public health measures that we've been doing have also helped. But we're seeing that the number of cases, although they're continuing to increase, as we mentioned before, they're not rising as much as they were, as fast as they were. So there does appear to be a handle on that. We are hoping that spring break does not bring about another surge. We'll be watching that over the next week. The other thing is that the number of deaths appears to be slowing down significantly. We still have a good number of hospitalizations, but that has also decreased, and we're happy about that. However, we still have, we're in the yellow in Tennessee when it comes, in Davidson County, when it comes to our hospital bed availability and our ICU bed availability. So we're watching that very closely, especially if there is another surge, that could be a problem for us. The other thing is that this is National Kidney Month, and I wanted to just mention a couple of things about that. As you know, kidney disease and kidney failure are very serious illnesses that can affect African Americans in particular. And those of us with high blood pressure, those of us on certain medications that affect the kidneys, those of us that may have a family history, we need to be extra careful to take care of ourselves. So some of the things you want to do if you're at risk is to meet regularly with your doctor so that your numbers can be checked. The BUN and creatinine, the creatinine in particular, you want to keep an eye on. If you already have kidney disease, they're going to need to watch for other numbers as well. So it's important to get regular checkups. The other thing is to monitor your blood pressure. And even though you're on blood pressure medicines, your blood pressure needs to be monitored periodically so that you know if the medicine is keeping your blood pressure under control. And remember, if you've been told you have high blood pressure and you've been given a medicine to start on, make sure you follow up. Don't assume that when you finish that prescription that the blood pressure is going to be better. Hypertension is a disease that doesn't go away usually. Occasionally, if you lose a significant amount of weight, it can. But this is something we need to monitor closely because it can affect other organs. And without you feeling anything, you may not feel bad initially until later when things happen. The kidney is one of the main organs that hypertension can affect. And you want to make sure that you are in control and you are aware of what's happening, because we don't want this to creep up on us and we end up in kidney failure. So the other thing is the medications. As we mentioned, there are medicines that affect the kidneys. In particular, non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, which is also called Motrin or Advil, naproxen, which is also called Aleve or naproxen. These are types of medicines, or aspirin even. These are medicines that can affect the function of your kidney long term. So if you are at risk for kidney disease, this is something that you want to keep an eye on. You need to follow your creatinine. Your doctor needs you to come in on a regular basis so that you can be monitored. You may have back pain or neck pain or some kind of chronic pain where you're taking these medications. Be aware that they can affect other organs, and just keep an eye on that. The other thing you want to do is physical activity, decrease your stress, make sure you get plenty of sleep, watch your diet, and especially if you have kidney disease, you will need to watch your diet. If you have chronic kidney disease that you're being treated for, you need to watch your diet in particular. The final thing I want to remind you of is smoking. Smoking will definitely affect your kidneys. It affects the small arteries in our body, and the kidney is one of the organs that can be affected. So, why am I mentioning kidney disease? Like we did with heart disease, kidney disease is one of the risk factors that will cause you to have a higher morbidity and mortality with COVID. What does that mean? That means that if you have kidney disease, you're more likely to be severely ill, hospitalized, and the risk of death is much greater. So I hope that is information that you can use. And we, as always, hope that you have a blessed week. Stay safe, stay healthy, and stay prayed up.